One of the most frequent questions that I get concerns chemotherapy. It usually starts out something like, my friend is on chemotherapy for breast cancer, et cetera, how much Kangen water should she drink? Well, first of all, she could drink all she wants because there's no magic or mystery. Kangen water is good for any human condition because it is the best water you can drink, just parenthetically. During chemo, many doctors advise that antioxidants be discontinued. Well, it turns out that there's a total myth, and that is completely wrong. The antioxidants do not adversely affect chemotherapy, and it is absolutely shown by a number of studies that no harmful effects occur if you're on chemo and if you are taking antioxidants, whether that be in the form of Kangen water or any other antioxidants. The NIH did 3 separate focus groups on compliance with doctors' orders, and they found that in study groups where people were asked to discontinue their antioxidants, whether they be in the form of pills or whatever, nutritional supplements, only 20% complied. So it's a total waste of time to ask them to do it in the first place. And also, a review published in May of 2007 by Cancer Treatment Reviews, 855 studies were reviewed, and not one single one showed an adverse effect of antioxidants while on chemo. And so basically that chapter is closed. If prospective clients and so on ask you about that, you can say unequivocally antioxidants are good whether you're on chemo or not. Now, what about benefits of Kangen water in patients who are undergoing chemotherapy? Are there any? Well, let me say that they are actually quite huge, and I do that based on personal experience. Dr. David Carpenter and I have corresponded, we were friends, and he has the same experience, that the side effects that patients get with chemo, nausea, vomiting, loose bowels, etc., are much lessened in those that faithfully drink their Kangen water. And I think I know the reason why, because when you get dehydrated, all these symptoms get worse. When you get dehydrated, you may become acidotic, and all the symptoms get worse. And you know very well that this water produces an alkaline effect in the body, and that it can actually reverse metabolic acidosis. This has been proven without any doubt in laboratory studies on mammal animals that were rendered profoundly acidotic, and the acidosis was reversed virtually instantly by the administration of Kangen water. So the benefit in chemotherapy of drinking Kangen water is huge. Now, what about radiation therapy? It is being used widely throughout the country for certain types of breast cancer. It's used for other different tumors, and of course, it produces side effects, and the side effects are usually burns. They're worse in fair-skinned people. There's nothing more, heart-wrenching to see. We get some fair-skinned Celtic person, snow-white skin, and the burns are very, very nasty. The ingestion of the Kangen water helps healing, and the topical administration of 11.5 pH water, say you take a towel or something like that, wet it very well, lay it onto the skin for 15 minutes twice a day, especially right after the radiation treatment, and it is an amazing effect that this has on ameliorating these types of symptoms, and I highly recommend it. And by the way, you don't need FDA approval for that. Water has been used to treat burns since antiquity. We know it puts out the fire. Another question. I have a prospect who has cancer. Will the water help? Well, first of all, there is no scientific data that we can quote that the water would cure cancer. You might recall that Dr. Otto Warburg is frequently quoted as stating that cancer cannot exist in an alkaline environment. Unfortunately, that is the most gross misquote, because he never said that. What he did say is that cancer can live in the acidic environment that it creates because it uses a different pathway to create energy. It uses fermentation rather than oxidation. Believe me, cancer can survive in an alkaline environment. The rates of cancer that are in the world existent today prove that. However, because the product promotes wellness, because the product gives us good hydration, and good hydration makes people feel better, people with cancer should drink all they possibly can, because it will make them feel better about themselves and also improve their sense of well-being, which is, as far as I'm concerned, the best thing that you can do when you have a miserable disease. Now, what about kidney patients? That's the third or fourth most commonly asked question, because for unclear reasons, there is a warning on the brochure that comes with every machine about troubled kidneys. You shouldn't drink the water. Well, actually, there's absolutely no reason why, and I mean that sincerely, there's no human condition in which the water is contraindicated. In cases of severe kidney disease, there are some precautions that must be followed, and they make perfect sense. As the kidney function deteriorates, the amount of urine that can be made every day may be limited. So if you drink 5 liters of water and can only make 1 liter of urine, you're going to have trouble. It's going to back up into your lungs, you're going to be in failure, and so on. So doctors routinely put these patients on fluid restriction. It's not water restriction, it's fluid restriction of any kind. So if you're allowed to drink 3 liters, you can drink 3 liters of Kangen water, but you can't exceed that. And I think that's the most important take-home message. As a matter of fact, I have at least 3 patients who were on dialysis and hated it so bad they were willing not to be on it at all and take that risk. I introduced them to the water, and they're feeling perfectly fine. A couple of them are now 2 years and still going strong. One of the other therapeutic things of Kangen water in the presence of kidney disease is the fact that it is so alkaline and that it can reverse acidosis. People who are what we call uremic, whose kidney function is really bad, are always acidotic. That's why they lose their calcium from their bones, they get fractures, and so on and so forth. Because Kangen water is a buffer against that and can reverse the acidosis, it is of great therapeutic value. It certainly is much better for you than bottled water, Coke, or any sports drinks. Now, here's another question, and this has been battered around a number of times and asked in different forms, which is the following. Can you become too alkaline by drinking too much Kangen water? And the answer is absolutely no way. Our bodies have a very, very efficient mechanism of dealing with acid. And there are 2 pathways, one through the lungs and the other through the kidneys. What is, however, possible is to develop water intoxication. And that would occur long before there would be any pH effects. Now, picture this. The water is hypotonic. In other words, there is less mineral concentration in water, in the Kangen water, than in your serum. So if you drink a huge amount of that, you will dilute the sodium in your blood and in your serum. And when it gets to the around 120 milliequivalent stage, you're prone to seizures, to all kinds of things, and it can even kill you. There was in 2007 a case in Sacramento, California, where a radio station had a water drinking contest. And a 27-year-old mother of 3 died of water intoxication, general seizures, and her heart stopped. And the cause of death was determined to be water intoxication. And her family won a $16 million jury award for the fact that this was negligent behavior on the part of the radio station. Now, organ transplants. That's a frequent question. My prospect doesn't want to drink the water because she had a kidney transplant and will think it will interfere with her anti-rejection medicine. Well, let me say this. I don't know of any medicine that Kangen water interferes with. I think that's a total myth. If you think about it, if you live in Seattle, Washington, the pH of the drinking water is 10.5. And, you know, does that make sense that it's okay to take your pills with that water and not okay to drink it with Kangen? It makes no sense whatsoever. And in fact, I have now met 3 heart transplant patients who are in the Kangen water family and multiple people with kidney transplants. And there's absolutely no way in which they have been adversely affected. Remember, transplant immunity is a highly complicated system of rejection and anti-rejection, and the medications are highly complex. Water is an extremely simple molecule. It is part of us, and the actual negative charges and so on that we think will absorb into the body are dissipated very, very early. So, organ transplants, Kangen water, totally compatible. This particular question comes up kind of frequently, and it's been a little bit difficult for me to address. It usually goes something like that. My friend has come home from the hospital, and they told him or her they have 3 months to live with a terminal disease. How much Kangen water should he drink? Well, I sort of have the same reaction. You know, I take a big bottle of scotch myself, but you know, I'm sure the question it comes from the heart and it's well-meaning, but one must be careful that somehow or other it isn't portrayed as some potentially last-ditch life-saving device, because, you know, it could really hurt people. So one should be very careful. Obviously, you can drink Kangen water till your deathbed, till your last dying breath. The question arises, would you want to? It's your choice. Now, Coumadin. Oh, my word. Coumadin comes up at least twice a week in questions. I am on a Coumadin. Can I drink the water? Yes, 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 yes. Absolutely. Why? Coumadin is a drug the efficacy of which is affected by many, many factors, most of them things like green vegetables. If you eat too much broccoli and you're on Coumadin, it'll screw up your test. If you eat too much spinach, I mean, there's so many different things that affect it, which is why all patients on Coumadin must have regular tests to check their INR or the activity of the Coumadin in the blood. And so whether it is true that Kangen water might obscure the test somewhat, it's immaterial because you're obligated to test the patient and you can always adjust the dose appropriately. So Coumadin and Kangen water, absolutely, no problem. A doctor told me to stop drinking Kangen water because I am allergic to the minerals that it produces. Well, let me tell you something. It can't produce any minerals. The only minerals that are produced are the ones that have gone in from the source water. You can't de novo produce minerals from a 240-watt machine. During a nuclear reaction, new elements can be produced, but that's what it takes. This one is really cool. I have been told that ionized water can cause minerals in the blood to form crystals, which can be very bad. The answer is yes, that is very bad. However, crystallization of any type in any system, whether it be in water or in some other fluid, requires a supersaturated solution. 5 pounds of sugar in a glass of water, that's a supersaturated solution. You can grow crystals on a string and it'll crystallize, but not in human blood. The only case of human crystallization I've ever heard about was in the Bible, where Lot's wife looked back at Sodom and Gomorrah and turned into a pillar of salt. And then there is a list, I'll just tell you a quick list of conditions that I've been asked about and have been asked to advise on how much and what pH water to drink. These are by no means all of them, but lung, liver, and bone cancer, leukemia, melanoma, brain tumors, Hodgkin's disease, pancreatic cancer, colon cancer, stomach cancer, ovarian cancer, uterine cancer, throat cancer, breast cancer, bladder cancer, prostate cancer, and myeloma, and others. And the answer is all the same for all of them. The water is good to hydrate people who are chronically dehydrated, which most cancer patients are. It does not cure the cancer, but it definitely can't hurt, and it might just make you feel better. Implanted devices, that's a very common question. I have a mitral heart valve. Can I drink Kangen water? Well, you have to picture that once a device is implanted in someone, whether that be a pacemaker, a heart valve, a breast implant, some other hip, for example, total knee, the body accepts it and forms a membrane, a fibrous type of membrane around it, which virtually excludes it from the bloodstream or anything else. And there's absolutely no problem with any implanted device and the drinking of Kangen water. Now, the other thing is that more and more of the implanted devices now contain noble metals, such as platinum or titanium. And these are particularly non-reactive. They are totally inert and completely safe. Returning a machine, ploys that are employed to return a machine and get the money back, like, a year after you bought it, that's a little late for buyer's remorse. If you return it within 30 days, no questions are asked, and that's the end of it, and you get your money back. Unfortunately, people will make up reasons that are not just unbelievable, but they also threaten, or they're threatening the company with legal action and with reports to the FTC and the FDA and all kinds of things. And there's always some doctor quoted that told them to do this because it's making them sick. Now, some of the conditions that I've been told were the result of the drinking of the water are hives, rashes, acne, sour stomach, diarrhea, all kinds of stuff. The interesting thing is none of these people had any problem when they were given the water for free, and all of a sudden, it's buyer's remorse and so on. Heart palpitations is a very common thing. I get heart palpitations when I drink Kangen water. Please, you get heart palpitations for 50 million reasons, and almost none of them have anything to do with liquids, Anyway, the bottom line, there's no way in which Kangen water can cause any of these conditions that are claimed. Certainly, Kangen water doesn't cause urinary tract infections. I mean, the bacterial theory developed by Robert Koch in 1848 has been proven to be sound. Now, when one resorts to these kind of tactics, one is actually committing a crime. Extortion is illegal. It's just illegal, and it's sad that people do that. But anyhow, The last thing I wanted to talk about is sort of an interesting subject because I hadn't really been, knowledgeable at all about it. I've had to do a little bit of research. But apparently there is a sizable population in this country that likes colonic therapy. And I have never had a good grasp of that. As a matter of fact, I need one more colonoscopy in my life before I can call it quits. And I dread that. I've already postponed it 2 years. But I often, I don't want to be rude or anything, but I get asked, how much of a mixture of 11.5 and 9.5 should I use to give my clients an enema? Well, I don't know. I mean, I don't want to go there. But to make a long story short, in the interest of safety, I'd like people to know that strong acidic and strong Kangen water are not for drinking, and that you should never put anything in your colon that you wouldn't drink. So, my other role, I think, as medical advisor, is to advise the company on perhaps how we can get closer and closer to some real valid approval by regulatory agencies. And to that extent, I think what we need to do, and some of it is being done, some is not yet being done, the bottom line being cost, but the antioxidant capacity of the serum in people who drink Kangen water cannot be measured because of the nature of the tests. So, strictly speaking, we can't prove that you are drinking ORP 800 water and so on because we can't measure the effect in your blood. However, I've recently discovered a new test which shows promise, and hopefully I can get that done because that would establish a structure function claim. And as you know, antioxidants are widely recognized as having a positive effect on human health by the FDA and all kinds of other agencies. Now, the other thing, the alkaline effect, the benefit of that, I think we're well on our way to being able to prove that because we have laboratory animals that have been subjected to profound acidosis, and we've been showing that this can, in fact, be reversed by Kangen water. The bactericidal effect, we've been studying this now for 1.5 years, and there are problems with it because the standards that the EPA demands for these tests are extremely rigorous. We know that the acidic water will kill every bacteria known to man, but it won't kill it in 30 seconds and under certain circumstances that are required by the FDA. And we're working on that, whether or not that'll require increasing the wattage or perhaps some enhancers, we're not there yet. And finally, there's another thing that we should do. We should show and demonstrate the emulsion coefficient of strong alkaline water, the 11.5 water, because that would allow us to market it as a pesticide removing agent. They have to have a certain degree of emulsion coefficient, which is easily tested, and then you could in fact say that that's where the red tomato test comes from, the emulsion of the pesticides into the water. And this is sort of pretty much up to date, and we're going on, and the slides, for bizarre reasons, wouldn't transmit over here, but this is the Enagic logo, and like the Knights Templar, it says, in hoc signo vinces, in this sign we conquer. Thank you very much.